So the test is $190, but you guys will pay it through your tuition. So summer tuition is your most expensive tuition.
Oh, okay.
Yeah. Yeah, but that's included.
The testing?
Yeah, plus it's 14 credits. Summer's 14, so
Oh, okay.
it's expensive. Yeah, but if you don't pass, which you guys are going to pass,
Yes.
you can retake it, I think, up to 3 times in a year, but every time you have to pay $190. So. Hey, Jennifer.
Hello.
So we're talking about the certification exam. So when you guys take it for the first time, you'll still be students, and it's a requirement. You have to take it to pass the class. You'll take it here on campus at the testing center. But after that, after you're no longer students and you're graduates, then you have to schedule it on your own, and you have to, the closest is Albuquerque.
Oh, man. That's a long drive.
Oh,
You're like, who's she talking
I
to?
know.
I haven't put her up on the screen. Jennifer, you're not on the screen, on the big screen. No, they just think I'm talking to myself.
Okay. That works.
But that's okay. So yesterday in lab, we talked about scalpel handles. Well, maybe I should start in the chapter, and we're covering chapter 10.
Okay.
So as you guys know, instruments are classified according to what you use them for, right? So cutting and dissecting. We have scalpels, scissors, bone cutting instruments like osteotomes, curettes, chisels, gouges, and rongeurs, saws, drills, biopsy punches, adenotomes, dermatomes. What does that suffix tome refer to? Yeah, so it's an instrument that cuts, okay? So remember that tome, osteotomes, and things like that. That's what their purpose is to cut. And then, of course, a lot of times people think of scalpels as knives, but we refer to them as a scalpel in the operating room. And as you guys are finding out, there's several different handles. There's a 3, and I was telling you yesterday that there's also a 3 long. So it still has a 3 on it, just has 3L. And those are for obviously deep procedures when you're doing a procedure and you need a knife it's long. It's for the way in the abdomen usually, okay?
So there's 2 sizes of 3s.
So there's just the regular 3. The end is exactly the same. The only difference is it's longer.
Oh, okay.
Okay. So it'll say 3L on it, which
3L.
means long. And then 4 and 7. And you guys seen all except for that long one. And we do have a long one. So you guys remembered which blades go on the 3, 7, and 9?
3,
4.
7, 11, 12, 15.
10 and 15
4
are,
goes on 20. Or 20 goes on 4.
yeah.
Right, yeah. And then they did mention a 25. I've never seen a 25. And we don't have one. So I guess there's a 25 blade that can go on that number 4. But I haven't seen it. It must be bigger than the 20. I don't know. Beaver blades, those are usually for ENT. And those fit on a beaver blade handle. And it's a real small little round type handle. The number 12, which is that one I said you're hardly ever going to see used. And here it says they're used pretty much exclusively for tonsillectomies. But they don't use them for tonsillectomies anymore. They have kind of like a cautery suction that they use that cauterizes, it cuts it off and it suctions and cauterizes all in one instrument, which is nice. They say that patients heal a lot faster using that.
Number 12, did you say?
Yeah, that one curved one that we looked at yesterday. Yep.
We get to see, but we'll never get to see again.
Oh, those?
Yeah.
Dell said that they use them on nerves sometimes.
Oh, okay. So
Yeah.
if you're working, maybe like a neurological.
No,
might
he
see
was
one.
saying ENT.
Oh, okay.
Yeah. Yeah. So, I mean,
Rare
there might
cases,
be.
you might see one.
Yeah. Yeah. Sometimes you might see one. And then that 11, remember I was telling you about 11, what they use it for?
Oh, is that the stab?
A stab. Yep. And then they also use them on vessels or veins when they're doing like vascular cases to make an incision.
Just make an incision.
Yeah, they'll just in the vein or whatever it is they're working on, they'll just make a kind of, of course you're not going to stab it, they just kind of get it and just go like that. Because they make small incisions on those. I mean, you're dealing with really small things. You guys know what the Mayo scissor is. It says here that occasionally they're going to use it for cutting dressings or drapes or drains, and not always just non-suture items. That isn't true. Okay, there's bandage scissors that come in the tray, and those are used for dressings or drains or drapes. Okay, they don't want you using the straight Mayo because to keep it sharp, you're going to be dulling the scissor by using it like that.
I'm sorry, you said which blade is used for the stab incision?
Yeah, the 11. And it'll also be used on vascular things. It says Mayo scissor, and they're talking about a straight Mayo is rarely used on tissue. It's always used on suture. That's, again, if they're talking about a straight Mayo, yes, that's right. And then Matson bombs are used for medium and fine tissue, delicate tissue. There's some other scissors that you guys haven't learned yet, which are Jameson, Westcott, Stevens, Tenotomy, and a Potts Smith. And they're on 267. See, that's a Potts Smith. Yes. A lot of times the scissor, the handle and stuff is shorter. So they're not very long. They're about this big.
Question.
Mhm.
What is the KAI on the tip of the blades?
I don't know. I'm not sure if blades have those on them, to be honest. I don't know if that's.
My son, I call him Kai.
Oh, yeah. And of course, it doesn't say anything in here about it. But I don't think I've ever noticed that on them. So grasping and holding instruments. So they're used to manipulate tissue, dissect, to facilitate dissecting, stabilize fractured bone. And then, so if they do have grasping and holding, remember forceps are usually going to be in their non-dominant hand. Okay, so if you've got to use two hands, if they're using pickups, they're going to be in the non-dominant. Okay, and there's quite a few surgeons that are left-handed.
That's awesome.
Are
I'm
you
left-handed.
Well, that's good.
Yeah, I'm the only one in my whole family.
There always has to be at least one stranger.
Yeah.
My husband's left-handed. I always tell him he's weird.
Well, I write upside down.
A
So,
lot of left-handers do.
yeah,
Nobody else,
if I don't, I smudge it.
nobody else lefty in here?
You do both.
Really?
Yeah,
Can you write left-handed?
yeah.
Yeah.
I mean,
You're
it's
ambidextrous?
as pretty as the other buttons.
That's pretty awesome.
She's awesome.
I write like a kindergartner when I use my right.
Ah.
I guess
Yeah, that's how it would be for me if I tried to use my left.
I'm pretty sure by the end of my 4-year-old's pre-K year, I just might have her writing better than me right-handed.
So we were talking about the instruments. Remember I was telling you we're going to go over the parts of an instrument. So that box lock is that little square part. If you look on page 268, it shows it there. Okay, and then the shank is the long part. And then, of course, the jaws. So ringed instruments have 2 shanks that connect the ring handles to the box lock. And the box lock controls the opposing jaws of the instrument. And then remember the serrations, and you guys have seen this. They might be horizontal, longitudinal, or cross-hatched for better traction on tissue. So it helps to hold the tissue. So that's why DeBakey tissue forceps have those serrations the way they do to hold on to things. Retracting and viewing, and you guys have seen some, very few of our retractors so far. Self-retaining retractors are Fleetlanners, Gelpy, Bookwalter, O'Connor, O'Sullivan, and Balfour. Those other ones that you guys don't know yet, those are the bigger ones that you're seeing, like on page 269B. That is, I just said it. O'Connor, O'Sullivan. No, actually, that's the Balfour, sorry. They don't show a picture of the O'Connor, O'Sullivan here, I don't think. And we have some of these retractors in the lab, so you guys will learn those. So those other ones, Bookwalter, O'Connor, O'Sullivan, they have different size of blades. So, you know, when they get deeper or they need more things retract, you can put on longer blades or wider blades. One of them, the Thompson retractor, is, I know it's got 52 pieces. So when you have to count, you got to count all those. You don't have to know what everything is called. Or, I mean, it's kind of obvious, but you just count every piece. And there's, so anything that has a screw on, you got to count it. So like Thompson retractor, it's got 52 pieces. And then the other ones, the other big ones, have probably 50 or so pieces. They're big retractors. They're used, you know, for big cases. You certainly don't want to have to retract that stuff back. So it's always nice when they use a retractor like that. And a lot of times, like Thompson, it's attached to the bed. So it has a bar that attaches to the side of the bed that comes up and it holds those blades. So the surgeon can put in a retractor blade and pull it back and then just tighten it onto that bar. And you guys will see those. You'll see them during clinical. And that helps stabilize things, keep everything out of the way. The Greenberg, I've never seen a Greenberg retractor, but it mentions it mentions it here. And then you guys have seen a few of the handheld retractors. We've got things like malleables. Like I told you guys, hopefully you don't have to hold those because they are kind of a pain to hold. So they're called malleable, sometimes ribbon, same thing, ribbon or malleable. And they can be bent to the desired position to hold things. They got brain spoons, that's also a malleable retractor. And of course, those are used on the brain to hold things out of the way. They're like the malleables that you guys seen, just small. So you can put a bunch of little ones in there.
What was it called?
That one is brain spoons. Then viewing instruments, they might provide retraction, but their main function is to be able to see what's going on. I know when I was working in the OR, they had retractors that had lighted retractors, and they still do. But the main thing was, the reason they're using those is because they need to see. Like when they do breast reconstruction type stuff, they got to go really deep, and they can't. Plastic surgeons always like to keep really small incisions. So if they're putting implants or something, they make the incision small. You'd never know that somebody had surgery by their incisions because they keep them small. Also, they put them in places where you can't see them. But they'll use a lighted retractor so they can see in there. And then there's probing instruments. So they're malleable wire-like instruments that are for exploration of structures like fistulas, vessels, and those are called probes. They do have gallbladder probes too that they'll stick in the duct to make sure there's nothing in there if they need to. For the most part, because they do things laparoscopically, they're able to get, the stones are usually not in the duct. If they are, then they have to open the patient to get it out. And then there's dilators. So some dilators are like Haney and Hagar. Those are cervical dilators. Okay, so for GYN type procedures, they'll use those. They're double-ended, so if one side is smaller than the other, one end is small and the other end is a little bit larger. And when you're using dilators, of course, you usually start off with smaller and then go up gradually, thankfully. Mm-hmm. And then also for the men, there are Van Buren urethral dilators. And those are for just urology type procedures. They'll dilate the male urethra. And yeah, it looks about as bad as it sounds.
Sounds bad.
Yeah. I always feel like, hey, that's nothing compared to the stuff they have for women. And it isn't. They also have bougie, and those are esophageal dilators. Bougie. That's on page under dilating. And again, it's to dilate the esophagus. When they're doing, let me think. For patients who have acid reflux, severe acid reflux, sometimes they have to do a procedure on them. It's called a Nissen fundoplication, and it's actually flipping. I don't know if it's the esophagus. I can't remember. They flip it. You have to put those dilators in to make sure they're not accidentally suturing that to the stomach.
That's what they did.
Yeah, it's an interesting procedure.
Yeah.
And we'll get to that too.
YouTube.
Yep.
They have all kinds of stuff.
Oh yeah, they do. And you guys will use it a lot. And you guys have seen needle drivers, of course. There's lots of different types of needle drivers, and you guys will become familiar with some of them. The jaws are tungsten carbide inserts with cross-hatched serrations, and that's for holding onto the needle. Every now and then you're going to see smooth needle drivers on the end. Plastics likes to use smooth ones. They just want to make sure that when they're going through that needle isn't going to stick on anything. They have microsurgical needle holders. There's a good variety of needle drivers. Some of them they'll lock and some don't lock. Like when you're doing eye procedures, the needles are extremely small. I mean, you can almost not even see them. The suture on them is so fine you cannot see them. So the needle driver is also very small. It was always really challenging to try to put one of those needles on a needle driver. And most of the time you're going to just be lucky enough to get the needle on the needle driver, and then you hand it to the surgeon and he's looking at it under a microscope. So he'll adjust it. He or she.
What is he suturing?
It just depends on when they do cataracts or other eye procedures. Sometimes they have to suture over. Most of the times the eyes heal very fast, and most of the time it doesn't require suture. But if after they're finished, because they put a lens in to replace the one that's damaged, every now and then they have to go back and put a suture so it'll quit leaking. But usually
It's
it's
gonna be irritating.
I guess it isn't.
No.
No. Yeah, they don't. I don't.
My grandma just had cataract surgery, and so I was just wondering.
Yeah. And it heals quick. So. Suctioning, and you guys have seen some of the suction that we use. Yankauer. There's Yankauer, no H.
Okay.
And then pull. Those are both used on abdominal procedures, but Yankauer's used for ENT. It's used for everything.
When you say ENT, what do you mean?
Yeah. So like when they do tonsils, they'll use Yankauer. Anesthesia always has a Yankauer.
I have a question.
Uh-huh.
While everyone's taking notes, is it literally just taking notes, or do you have instruments there that you're holding up?
No, I don't have any instruments.
Okay, I just want to make sure I wasn't missing anything by just looking at everybody.
Oh, yeah, no instruments in here today. When you come here in 2 weeks, you'll get to see the instruments.
I know, 2 weeks. Okay.
And it says there in the chapter, Yankauer suction,
Right.
designed for pharyngeal suctioning during
Yeah.
tonsillectomy. And then pull suction, you guys seen that one yesterday, and you might have already seen it.
Yes.
It helps the surgeon to rapidly aspirate large amounts of fluid, irrigation in the abdominal cavity without interference from abdominal viscera. So we don't want to suction that up or get in the way. They just suction. And it also prevents damage to abdominal viscera. Let's see, microsurgical instrumentation. They're typically made of titanium or stainless steel, but titanium is preferred because it is stronger and yet lighter in weight. And then it says that they're designed to be held with the thumb and the forefinger, allowing for more subtle movements than are allowed with the ring finger. And the for micro instruments, they're usually spring loaded and they have a locking device, and we'll show you guys those. So instrument care and handling, there wasn't really anything in the review on that, because I don't think there isn't anything on the test about it. But they are going to clean and decontaminate instruments, inspect and maintain them, reassemble, and then prepare for sterilization, and then they sterilize, and then they store them. So there's quite a few steps. I'm hoping that maybe I can get you guys a tour of Central Sterile, because it's really pretty fascinating, everything that they do. The people that are in Central Sterile, the ones that actually get the dirty instruments, they have to wear like a gown, but it's kind of a heavy gown that they wear. They wear gloves, mask, face shield. Yeah, because they're dealing with all these chemicals that they have to clean the instruments with.
So I'll just push them through a dishwasher and turn it on high.
No, first they scrub them. Yeah, they actually like wash dishes. So they'll scrub them and they'll try to get rid of any bone,
Obvious
tissue,
stuff,
anything
stuff.
like that. Yeah. They have things that they can stick in if there's things with lumens. So they have scrubbers, like brush scrubbers that they stick in there, all kinds of sizes. They use toothbrushes to clean things. So they have a lot of different steps. And then after that, it goes into kind of like a dishwasher that kind of shakes anything out that might still be left in there.
So
And then
if
they
you
go.
have like a standard major kit and pretty much, used everything in there, how long?
It's quite a process, probably 4 hours. Yeah, so I mean,
Really?
so at hospitals and surgery centers, they have multiple amounts of
Okay.
things because for that reason, it takes quite a while.
It takes a while.
Yeah.
It's not your 45 minutes.
Oh, no.
It's several hours.
Yeah. Yeah.
They use like really big autoclaves, or they're pretty small.
Yeah, they have big autoclaves, and they have, I think, 3 at San Juan. Yeah, they try to do most of the big loads in the evening, and then they have racks of instruments that they stick in the autoclave and try to do them all. Yeah, so it's a process. So you guys on 273, you see a example of an instrument list, and you guys have seen that. This one's just different. Then we got scopes that we use, so endoscopes. They're used for diagnosis, biopsy, visualization, and repair of structures within a body cavity or the interior of a hollow organ. So they're either going to be rigid or flexible, or semi-rigid. And usually these can be done, the endoscopes can be done on an outpatient basis. And you guys will see, you'll have the opportunity to see some colonoscopies, EGDs, where they go down the throat, just different procedures like that. Like here, they don't do those in the operating room. They have certain parts of the hospital that basically just takes care of those procedures. And then they also have like outpatient places that patients can go for those. In Cortez, they do them. They don't do them in the OR. They have like a separate room, but they let the techs and the students go in. And you don't really help. I mean, you just kind of, your job is usually just helping turn over the instruments.
Okay, so like down here, how we have the different surgical, like how down here we have the surgical centers.
Yeah.
Okay.
Sometimes patients are too sick, though, to have even those types of procedures done.
Yeah.
outpatient, so they have to be in the hospital.
Right.
So rigid scopes are typically used for cystoscopies, laparoscopies, thoracoscopies, proctoscopies, sigmoidoscopies, and arthroscopies. Rigid is preferred for retrieval of foreign body from the bronchus, but flexible is most often used for diagnostic. And they can be attached to a camera. When you see Dr. McCulloch doing urology procedures, he uses a camera on the end of his scope, but he doesn't use like a monitor. He just looks, he gets up close and personal. Colodioscopes are for exploration of the biliary system. Mediastinoscopes are for visualization and biopsy of the mediastinum. And ureteroscopes are for ureters. Angioscopes are for heart and major vessels or vascular endoscopes. Ventriculoscopes are for brain ventricular system. A lot of these you won't see used. Because a lot of times those are more for diagnostic, so they're doing them in a different setting than the OR. So like when they do angioscopes, they're doing those in the cardiac cath lab. So these scopes, they can use monopolar or bipolar cautery with them. And then we got powered instruments. So these instruments are usually powered by compressed air, nitrogen, electricity, or battery. And they can be used to drill holes in the skull, ream the shaft of a long bone. They can drill holes for screws to secure a plate on a fractured bone. They can use them to saw the femoral or humeral head. They can saw the sternum for access to the heart. Use to reshape bone for plastic or reconstructive procedures. To drive pins. Just cut skin, usually for skin grafting. So that's a dermatome. And to sand the skin for dermabrasion. So power saws either have a reciprocating, so back and forth, or oscillating side to side action for cutting bone, and the blades for these instruments are available in a variety of sizes and shapes. And I think Dale showed you guys saw, didn't he, and a saw blade? No, I thought I passed by lab and he was showing you one. No?
So,
Oh, I saw a blade last week.
Oh,
He
okay.
didn't, it was just in the kit. He didn't really show it to us.
He just
I
was
just
like,
picked it up. And
oh, okay.
so do these power tools kind of look like power tools in the garage?
Yeah.
Yeah.
Yeah, they do. They look very similar.
But
Yeah.
they're not made of plastic though.
Oh, no. No,
External
they're
cases
metal.
Usually.
Yeah, we have a saw in the lab, and I'm going to go in there here in a little bit and get some of the sponges that you guys might not have seen yet. I'll grab some of those. So I'll turn the camera towards me when I do that, Jennifer, so you can see them.
All right. I was about to ask, will you show me too?
Sure.
Okay. Thank you.
I always say that orthopedic surgery, because they do use drills and mallets, hammers, but to me that's just carpentry on people. Because it really is. I mean, it's almost the same. Microscopes, those are always a lot of fun to try to put a drape on because they're big and they're just a pain. It can be challenging, but nobody expects you to do that. Like first rattle out of the box, they're going to step you through it. Sometimes the surgeon will help you drape the microscope. Other times you just have somebody else in there helping you. So the focal length of the objective lens ranges from 100 to 400 millimeters, signifying the distance of the lens from the target tissue. And that must be a question.
Repeat what you just said, please.
I don't see it, but I underlined it. So the focal length of the objective lens on a microscope ranges from 100 to 400 millimeters, and that signifying the distance of the lens from the target tissue. So that's the distance when they're looking through the microscope. The working distance. And then there is video monitors, recorders, and cameras. And you guys have seen an example that we have in here, and this one is old. The ones they have now are flat screen monitors that are mounted off of like a boom so they can move them around the room a lot easier. It used to be that they were on a cart like that, and you'd have to move that cart, which was heavy. And now everything is like on a boom. There's fiber optic headlamps and light sources. So there's a picture of one on 277. So surgeons that are working in small areas, neurosurgeons wear those a lot. Because like when they're doing even spine cases, they make really small incisions and then they're working like in this little hole. With the microscope and that light, sometimes the light. A pulse lavage irrigator. It's powered by nitrogen or nitrogen battery or electricity. The ones I've seen are battery powered. So if somebody is in usually it's trauma type accidents that come in that maybe shattered things, or like they've got a lot of rocks and dirt and stuff inside their wound, they'll use the pulse lavage, and it just pulses water and it can suction it out too at the same time. So they'll do that to those types of, on those types of things. I know when orthopedics does like total knees or whatever, they'll use that because it really cleans out that joint real good.
Like if they're using a bone saw, don't you get all that fragment of bone?
Right.
In
So
the cavities, you got to clean all that out.
yeah. So it's good because, and I'll try to remember to grab one when I go in the lab to grab some other stuff. It's good because, you know, it really pulses that water in there. So it just really sprays it out. And then at the same time, it's suctioning it up. Yep.
Sterile water.
They usually use LR, lactated ringers, or something like that, or saline. Yeah, they don't. I don't think they use sterile water on those. And then phaco emulsifiers and irrigation. Those are used. They're ultrasonic energy that for cataracts, and it fragments the lens, and then it's able to basically remove that lens. So it cuts it in small little pieces and then it sucks it up. So it irrigates and aspirates. And then cryotherapy units are use liquid nitrogen, so freon or carbon dioxide, to deliver extreme cold through an insulated probe to diseased tissue. So could use that on brain tumors, vascular tumors, prostate gland, when they're doing retinal detachments or cataract extractions.
Defreeze it.
Yeah, I mean, you wouldn't notice, but that's how it works. Yeah. It doesn't damage the tissue around. That's why it's using cold. Insufflators. So insufflation is used when they do like any laparoscopic procedures. So they're filling the abdomen with CO2. And then they insufflate it. And I looked in the chapter to see if I could find anywhere where it said what the abdominal pressure should be. Did you guys find it?
Yeah, it's right there.
Is it right there?
It's on the end of the paragraph.
Really? I looked.
It's at the bottom.
Yeah, it's just under a little sentence by itself.
Oh, okay.
It's right above nerve stimulators.
Oh, okay. Yeah, I was looking. I was like, where does it say that? Yeah. So it should be 12 to 15. And then nerve stimulators produce very small electric currents that when applied to tissue, they help identify and preserve essential nerves. So for craniofacial, neck, or hand reconstruction procedures, they're going to use a nerve stimulator. It says it is especially useful for identification of the 7th cranial facial nerve during acoustic neuroma removal. So you'll notice when they're doing like hand procedures and they're dealing with nerves when they use something like that. It's amazing. I always like to watch the plastic surgeons when they're repairing nerves, because they'll pull on something and you're like, how does that work? And you'll see the fingers going like this. It's crazy to see how it all works.
So that nerve stimulator, is it like a pen?
Yes.
Type?
Yeah. Yeah. And anesthesia also uses the nerve stimulator to, let's see, that small, what? They just want to see if there's any nerve response. So you'll see them every now and then. They'll put it like right here, and
Checking to see
they're
if the watch is working.
yeah, they're checking to make sure everything's working right. All right, well, let's take a quick break. I'm going to run to the lab and get a few things while you guys take a break. Jennifer, you just hang in there, okay? I won't be gone long, just a few minutes. Go take a potty break.
I did mine before we started.
Ah,
Took care of everything.
good. We'll be back in a minute.
Okay.
I thought that,
That's where it was. That rolled off my heel and
I thought Sean was going to be on here with us.
Yeah, I'm gonna ask her if she is. I sent you some a message with a lot of questions
Okay.
because I feel better now that we talked. But I have a lot of questions on there, and I'm sure I'll have more.
Okay, that's fine. I'll be right back.
Alrighty.
Did we already do chapter 10 on my time?
Yeah, it was due Sunday. It's
Okay.
just like, you don't remember it because
Yeah,
chapter
but
12
everything
and
was
then AST.
Okay.
Yeah, we have a lot of stuff. I think chapter 7 is due soon, right?
Sunday.
Yeah, she switched it to Sunday. It was supposed to be yesterday, but she switched it to Sunday. That's good. I would have been like, I didn't do that one yet.
Yeah.
If I remember, I think chapter 7 is pretty easy. I did most of the mind's after that. What is chapter 7? This mind's out. Oh, that shouldn't be too bad. It only has 40 pages. No, I'm just kidding. I think a lot of the questions, if I remember correctly, was just based off the 2 charts that are in it. Oh, really? Yeah. Most of the questions were.
Is there a study guide for it?
That I have not seen.
I didn't see chapter 7.
Oh, really?
On Canvas?
Yeah. Yeah, a lot of this one.
Melody?
Yeah. So it's just like a lot of questions were just based on that.
Oh, cool.
Yeah, for us over here, we end up having to go a lot based off of the computer. So
The new.
What?
No, yeah, it does.
What?
Oh,
is
this
the 17? We didn't hear you. Speak up louder.
15.
I said we end up having to do a lot of our stuff based off of the internet. So I would like to think that anything you guys need is probably somewhere on the Canvas, just like it is for us.
Oh, yeah. Well,
Oh, cool.
You can get access the book online through
Touchscreen.
MindTap.
it is touchscreen?
Oh yeah.
And it's what? Hold on, I have to
It's the AI.
Yeah, on MindTap you can access the entire book.
For A15.
Right. And that's pretty awesome.
Yeah, it is.
It's like a one-stop shop.
I'll probably do that Friday. Just boom after a while. And then forget I did it.
I go to Treasure too.
I don't remember. Have you ever seen, probably not, but have you ever seen the 90-day fiance where they go overseas to find
Yes.
So I was watching that the other day, and now my phone is like, these Russian girls would like a boyfriend. No. I only watched the show like one time. I'm asking you to remember. That's funny. I was afraid I'm gonna sit in a seat and just flying back.
Well, if mine's supposed to get rid of it, it says dispose.
Oh, yours has the tag on it?
Yeah, dispose and dispositions. My name is supposed to be in here.
Is it trustworthy to sit in it?
I'm pretty sure it is.
What time did you guys' class end down there?
Last time.
So far.
We won't manage too hard.
I'll laugh too, so it's okay.
What time does your guys' class end up there?
3:30
3:30, that's right.
on
Okay.
Mondays and Wednesdays, 12 to 3:30.
And then on Tuesday, Thursday, God, I forgot the day. Your lab is from what time till what time?
2:30 to 5.
Okay, yeah, that's the one I can't do. Okay.
They are. We must have got the same one.
Is that what you got?
Kitten and Thompson.
Timelines. Let me see.
Oh, yeah. Yeah. I don't know where. That one. But Monty Sponges is also 5.
Okay.
This is the two next year.
Huh?
These ones.
Very well.
Oh, I work this, like all these look easy.
Yeah,
I'll work on that.
yeah. Because I've been doing it.
As we go.
Yeah, so. Well, kind of.
Looks like we have that to do, that's why I checked after 7.
And let's do Sunday. Yeah, I can do that too. Although I say that and then I wait till Sunday night.
You think she'll tell us the day or just drop it in for the assignment that's gonna be for tomorrow?
If you don't remind her, she might forget.
Cause that was random.
I have absolutely no idea what you were talking about, so you're okay.
All right.
Do you go through the actual website?
I'm in the app.
That doesn't look that good.
Unless you.
Just so those are due Monday? What's due Monday? The AST corrections. Oh, yeah.
Are you guys able to go in there without taking it again?
Is Jennifer talking to you guys?
Kind of.
A little bit.
On and off.
Yeah, I could hear in the lab, I was in there, I could hear somebody talking.
Yeah. Yeah, I'm not exactly a quiet voice.
That's
I
good.
accept that. When I worked at the bank, they even told me, you need to learn how to keep your voice quieter because we can hear you all over the place.
No miscommunication though.
Yeah, and I was like, but this is my quiet voice.
It's so fun. Which number is for which? When that comes to it.
So here's an example of the saw. Okay, and here's a blade here. I brought it in. There's a button up here you push and you just load it in like that. Okay,
I can't see.
I'll show you. And then you, there's a button right here. These are, of course, separate. This is your battery.
Not disposable.
Not disposable, no.
Are they
Are
yours?
the blades disposable though?
The blades are, yeah.
So what about the battery? Is it just like recharge it?
So there, we have a charger in the OR. Can you see this, Jennifer?
Oh gosh, yes. Oh,
Um,
that's the one in the book.
so we have a charger in the OR that holds 3 or 4 batteries.
Oh.
Yeah, of course, they're going to charge the battery and then they're going to sterilize it and wrap it or put it in a pen or something and send it to the OR because you always have to have more than one. Because as soon as you start working, pretty soon you need another one.
So is the one in the book on page 275 kind of the same, or is there a difference between the square end and the circle end one?
No, I think that's the same.
Okay.
Yeah,
Battery.
Hold that up for about,
yeah, maybe a different brand. No, it's
Okay.
actually the same brand. And then here's some examples of some plates.
Okay.
Okay, so if you can imagine breaking something that's gonna fix, okay, so probably like an arm, something like that, if you break it.
Huh.
Put it in
So when, gosh, my mom had an elbow broken, so maybe that's why it's not perfect.
And then
It's been years. It's been over like around 15 years, and she says it still hurts. So.
yeah. And then here's a screw, and this one
Oh.
has a hole in it. So like if you were gonna put a wire in to guide you where you're going, you can drive this over that wire and then they'll pull that wire out.
Okay.
I don't
That's
see
neat.
more screws in here, but here's just a few plates and that too.
so these are. What happened to that one?
They'll bend them to
Oh, okay.
for whatever
Okay, so-
wherever they're putting them, they're gonna bend them. They have plate benders
Okay.
that they use.
Okay. So it's not just easily bendable.
It's you wouldn't think so.
That's pretty damn strong.
Yeah, they're pretty strong. So the one that's bent probably came out of somebody.
So, and that's something that they would bring into the room. That's something that they would mold in the room,
Oh yeah,
in the operating room.
yeah. The surgeon does that. They
Okay.
get it and they are the ones who bend it.
Okay.
Okay.
Cool. Oh, my hand's a lot smaller than
So pulse lavage.
my hands. They're just
You got one of these?
smaller. It's-
This is pulse lavage, okay, and that's what it looks like. This one,
It has to be-
the battery still works. So this is a longer tip. Can you see this one, Jennifer?
I'm sorry. Give me just a moment. I was typing a note, so I didn't forget to ask you.
Oh, this one I don't think fits this.
Oh, and that's the lavage you said?
Yeah,
Okay.
battery operated, so, and I mean, they usually last longer.
Right.
Last
Did you see
longer
that?
than.
What if he screws this?
It moved.
I thought I had put it on and it would work there for a second.
Can you show me the tips?
So here's.
I'm just-
Oh, maybe it does work. Well,
Are you going to be showing those to us again when we're up there?
Yeah,
Okay.
hold them.
Looks heavier than like the normal.
So if you were going in something deep,
Okay.
like when they do
It's a lot heavier than
a nail or something, they might do something along like that.
These are heavy.
It is heavy, huh?
Are they always battery powered?
It depends. It's not always, because like when they're doing like totals, they need something that's not gonna give out on her. So if it's something quick, they'll use that, but otherwise they have electric, you know.
And how long do those batteries last?
Depends,
Depends on-
yeah, it just depends on the bone.
So how would you pass this?
It's like that. And you better pass it before they can use it.
So did she say these were bendable or they came with?
So they're not
Surgeon
powered.
bends.
Surgeon bends them.
Are these
Let's do it.
these are stainless?
Those were- Oh, the nitrogen powered ones, yeah, it's like a hose.
Maybe, okay.
Yeah.
That's
Will
what.
that be person?
Titanium or stainless? This one's titanium.
Yeah, they have like a top. Yeah, and then the same with other drills and stuff that they use. You can use
Actually, I still
electricity.
redo it because I
So you have to
did some
hold it.
stupid torque screws and torque plate right now.
That's the pulse lavage. So that other end,
What is it?
Runs them.
the other end of that pulse lavage is what plugs into the bag of irrigation. Yeah.
Oh, okay. Those are your plates. yeah.
So one, the reason that there's two is one is suction and the other one's irrigation.
In and out.
If it cuts off, I apologize. It keeps telling me it's unstable on my side.
Oh, that's fine. We'll catch you up. You can always click on that Zoom video and watch it later if it does.
Okay.
So plates and screws of course come in a variety of sizes and shapes.
Yeah.
Screws, you know, from really, really small for fingers to really big. Well, if they're putting a nail, you know, that's gonna go all the way down the femur, it's long.
That's cool.
Like I know like how a nail works for like two pieces of wood, like you put it.
Yeah.
Uh-huh.
How does that work?
Well, they put a nail, a rod basically that goes down your femur, and then it has places where they put holes. And then they,
Oh, yeah.
yeah, so they use X-ray continuously because they gotta see. They know more than that.
So what size do they use for the hands?
What size of screws?
Plates. Like for the,
Yeah,
for a middle bone like that.
yeah, something
It's a
a
case
lot
by
smaller.
case.
Yeah, and they're a lot smaller than those. And you want them, you know, where they're not sticking out, where it's obvious.
What's that one called? Yeah.
This one is a sagittal saw. Yeah, it tells you here on the side, sag saw. And they use those lines that can kind of tell them how far they need to drill it.
So that's a reciprocating?
No, it's
Oscillating?
Oscillating. Oh.
So you know what a sawzall
Yeah.
is? That's a reciprocating. It goes in and out.
Pulse
That's what
lavage.
you're side to
So,
I didn't see like how irrigating it.
yeah,
No,
one
you can just like,
irrigation,
it
one
like kind
suction.
of twitches. It's pretty awesome.
The other, there's another one that goes on that that's short, but I couldn't find one. And I was looking for some other stuff and I don't know where Dale put them. This is another, this is used for laparoscopic procedures. Okay, and so suction and irrigates and suctions, okay. So when they do like a lap chole, they're gonna irrigate in there to make sure there's no blood left. Usually they're checking the liver bed to make sure it's not bleeding. So there's, it looks like a pull suction that screws onto the end of this, and that's what goes on here. Okay, and then again, this part of it is handed off. One is for suction and then battery operated again. So
Now-
there's always lots of batteries that you can take if you need, like double A's after the case, because they use it for a few minutes and then they're done.
That would be awesome.
Oh, it's the same.
Never have to buy batteries anymore. So what's the difference between the red and the blue buttons?
So blue is for irrigating,
Okay.
and so blue is to me is like water.
It's like at the dentist.
Yeah, and then red is for suctioning.
Okay.
This is a Very's needle, okay? This is a Very's needle. Remember what that was used for? Insufflation, yeah. So, remember when that guy was here and he was talking about sometimes they'll just stick something like this in? That's what they're doing. They're sticking this in and then they hook the insufflation tubing to this end and it basically just fills the belly with air. CO2, okay? That's what that looks like.
What is this? Is this the pulse?
Pulse lavage.
So that one irrigates and suctions at the same time.
That one does, yeah.
And this one is
Same.
one or the other?
It doesn't do it at the same time. So they'll irrigate and then they'll suction out.
This part would go into the fluid.
No, the other part that you're holding in your hand, yeah, that does. It sticks into a bag of irrigation.
So for this,
And now other one goes on the suction canister.
does that have a safety tip on top? Or do they jab that whole thing in there?
They just jab it in there.
Oh.
Yeah.
Oh.
Okay. And so the little like lever underneath the red button would be how strong the suction is?
I don't know. Maybe.
You'd guess it.
Yeah.
It's a spring loaded safety, so like right now it's not gonna
How do they bend these?
pressure. You
They have plate benders.
and that's just there.
And the surgeon does it himself?
Yeah.
Yeah.
Yeah, they'll do it.
If you push hard enough,
Yeah.
he presses this.
Plus, you don't want to mess up, so they let them. Everybody's gonna mess up on something like this. You let them be doing it.
Right.
I know.
Yeah.
But as you can imagine, they're even.
Gases to use.
How was that?
So just really oxygen. So when they infuse, is it CO2 they use?
Yeah.
Needle, huh?
I know.
That's what that's. I'm just kidding.
And that's 10 to 12.
Millimeters per mercury.
Is that how much they put in?
10 to 15, 12 to 15.
There you go.
15 millimeters of mercury.
12. They have a machine that measures and it tells them how much they've got in there. Yeah, because to me it's like, what does that mean? I know they used to have like a little ball of mercury that. Sorry.
Can you physically, I'm assuming this is a yes, see the belly rise?
Yes. Oh yeah. Yep. and then they go,
They felt it.
yeah, they do. Yeah, and it takes a little while. It takes a couple minutes for it to fill up. Depends on how much skin you got.
That's cool, so it's got a little bit of a blade at the top.
What was this one
So
called?
they're used for,
That one is a suction irrigator, so it's used for laparoscopic. Did you guys see this one? Oh, okay,
Sure.
it's going that way. And what was your
paracentesis, or what is that? When you have
Oh,
compared to the ones in the face. What's that? Paracentesis, what is that?
Yeah, I can't think of it.
Suction irrigator.
What was that needle called?
There's.
Yes, there's V.
V-E-R-S.
It's VERSS, I think.
VERRES, it's on two.
Oh, RR, two R's.
So pluralcentesis. I don't know if I'm saying. This is the insertion of a hollow needle into the pleural cavity. Who would thought they would use?
Yeah, that.
And this is called the what?
It's a suction irrigator.
Same
the one
as
that-
the lavage without the pulsing.
Right.
Is that the one that blows in the water and then sucks it out too?
That one does. It's for laparoscopic procedures.
And this part is stuck into the water?
Yeah, that one's, it's, if you take off that blue, it's kind of there just for safety.
Oh.
That plugs into the bag of irrigation. And then the blue just goes up to suction.
Oh.
The suction can. More stuff to hook off of your table, off of your OR bed that you have to keep sterile. So that's the thing about laparoscopic procedures is that part of your job is to make sure all those cords and irrigation stuff like that, does all the cords stay on the patient and not don't fall off.
Just to stay in that sterile area, you have to keep it.
Yeah, of course you have to hand off stuff.
Right.
Like, you have to hand off the end of that because it's got to be plugged into the irrigation and to the suction.
And they just poke with that.
Yeah.
Dang.
is that like when you would use some of the non-penetrating towel clips to hold some of it on, or?
Yeah, and some of the drapes are made with those little Velcro type holders. So you can just run your tubing through those, which helps. All right, now going back to page 278, we've talked about lights. Most of ORs are equipped with 2 OR lights. Some, though, like that do open hearts or trauma or neurosurgical rooms might have more. And remember, they provide that intense light that is appropriate for the size of incision. So they can kind of adjust them. Those lights adjust. The light beam should produce no shadow and minimal heat. It's not a whole lot of heat, but you can feel it after a while. Tourniquets. You guys have all seen a tourniquet before? Yeah, and you know how they work, right? They basically they restrict the blood flow. So they'll use them on procedures where they want like a bloodless procedure. So when they do arthroscopies, when they do a knee arthroscopy, they put a tourniquet on the leg. And so while they're doing the procedures, you don't hardly see any blood at all. And then just before they're done, they usually release that tourniquet so they can make sure nothing's bleeding. And then, of course, there's a certain amount of time that they should have the tourniquet on for before they release it. What's that?
I don't remember the time, but I can't like a bunch of stuff be released back into the bloodstream and cause
That's it, the tourniquet's on too.
Yeah.
too long.
So they don't want to keep the tourniquet usually not more than an hour.
Nose upward
That's the
or any extremity?
Any extremity. So basically, I mean, you're stopping the blood flow for an hour. So they'll release it. Anesthesia keeps track of the time. So they will turn on the tourniquet. They're responsible for the tourniquet.
And then can they reestablish it?
Then they'll
after a certain-
reestablish it. if they
After a
need
certain time. Now, how
Yeah.
long does it take? Like you have it on for an hour, you release it for how long before you reestablish?
Usually just a few seconds,
Oh, okay.
Yeah.
Just to kind of get the blood going back in and then
and then they do it again. Yep.
Hmm.
Sometimes the surgeon might ask for a sterile. Most of the times the tourniquet is not sterile, but sometimes they'll ask for a sterile one, and so they do have them packaged up sterile. And that's so they can get close to it, okay? Because usually what you do is you put it on, and then we cover it with the blue towel. So that's when we use our little penetrating towel clips and put the towel over it, and then they're going to put other drapes over that. SCDs, sequential compression devices. So those are used basically on the patients, mainly on their legs, when they're going to be in almost any procedure. They'll put them on. So basically kind of just provides compression on the legs while they're asleep. And I always wanted to put those on, like when I was just standing there. I never did, but I wanted to, just to see how they felt, because they kind of tighten on your legs for a little bit and then they let go. It's kind of quick. Yeah. So most patients come back in the OR with those on their legs, and then they hook them up just before they start to proceed.
Those little things that inflate and deflate?
Yes.
Yeah, those are weird. I had that on with my C-section. Those are
Yeah.
weird. But one rolled off of my leg.
Ah, so they are to prevent venous stasis. So it reduces the risk of developing DVT, which can, of course, lead to pulmonary embolism. I don't know whether we're going to finish today. We'll see. We might get to sponges and dressing, probably. So drapes, they're lint-free, they're fluid-resistant, anti-static, they're tear and puncture resistant, they're free of toxic residue, they're porous enough so that the body heat is not retained, the finish with a color that does not reflect the operating lights. I never really thought about that, but they don't, they're not going to bother your eyes. If you had something too bright, it'd drive you crazy after a while. And they're flame retardant, so it should help them not ignite. So non-woven fabrics, the drapes are disposable and are typically made from compressed synthetic fibers such as nylon or polyester bonded with cellulose. Aluminum coated materials are preferred during laser procedures. So you guys want to remember that. Disposable drapes have reinforced layers of material surrounding the fenestration. What's the fenestration on a drape?
The opening.
Yes, the opening of the drape. So remember that too. So reusable drapes, it says, are popular with hospitals because they are cheaper than disposable drapes. Yeah, but then they have to clean them. So it's going to be pretty rare that you're ever going to see a reusable drape. Okay. Like they're saying the disadvantages is that they have to be laundered, folded, inspected. Some things that you will see that they do actually reuse is like the bath blankets. They will sterilize those. So sometimes they need a blanket for the procedure, like to put the leg on or something, and they want a sterile one. So they'll sterilize bath blankets. Incised drapes are adhesive backing that may be impregnated with an antimicrobial iodine agent. You guys remember seeing one of those on one of the videos that we watched? They're like stick. They peel them off. You guys don't remember one of those?
Which one?
The incised drapes. They have usually the color of them is like iodine. I can't remember whose procedure they showed.
It's like a plastic covering.
Yeah.
That they.
Was that on
the
yours?
skin. No, I don't know who's. I remember. That.
Yeah.
And then they
Oh.
just make the incision on top of the plastic.
Whoever did the craniotomy drape. So that drape that they put on the head, that a lot of times it's got that plastic coating, but a lot of times they use the, I can't think of the name of it. I'm thinking Ioban drape, and it has basically betadine in it.
So anything that has adhesion, because there was one even for the laparotomy where they, and I don't know if it was one of
I remember they did
videos
that
or
too.
something that I was just looking at, where they toweled it off
And then they put that.
and then put it on and the whole thing stuck to the stomach. Would that have been?
Usually they are impregnated, but the ones I've seen, you can see the color. That one you couldn't, so I don't know if it had anything in it. And then there's aperture drapes. They're small, clear plastic drapes with openings that are surrounded by an adhesive backing. Those are used on eyes and ears, so when they do eye procedures, they stick, in place. And then there's just an opening for the eye. And then same with the ears, just so the ear is exposed. And then, of course, there's lots of other types of drapes, laparotomy drapes. There's pediatric ones, transverse lap sheet, thyroid sheets, extremity sheets, hip sheets, perineal, craniotomy. So we've seen a few of those, like the lithotomy drapes, that it just exposes that area. First, whenever they are going to put a drape on, they're always going to square off that area, right? They make a square around the area. That's a question on, was it on this?
I don't think so.
I don't think so.
Okay, there, it's a question. So don't forget that they square off. So the shape is square. It's not triangle, although every now and then they do a triangle.
Oh, is that like when we put the first drape towards you and then?
Yeah.
Oh,
So basically, and that's called squaring off.
Oh,
Okay. I was looking for sponges in the lab. I'm going to have to ask Dale where he put some of the sponges because I wanted to show you guys an example of some of the sponges we talk about. But pretty much all sponges are going to have that radiopaque strip in it somewhere, even the little neuro sponges, and that's what I was looking for. I was going to show you guys those. But neuro sponges come in a variety of sizes. So I'll ask him where those are and show you guys those. Ratex can be used as on what instrument? Sponge stick. Yep. So anytime you're doing like a laparotomy, a big opening, you should never have Raytec on the field. The only time you have a Raytec is if it's on a sponge stick. Okay, they're not ever gonna. Well, I can't say never, but they don't usually ever ask you for a Raytec in those procedures, unless it's on a stick.
What kind of procedure?
Laparotomy, so large incisions.
Is that because they just get lost easily?
They could, yeah.
Sponges, are they always moistened with saline before?
No, not always.
I know it said like moisten them with saline.
Like when you're doing a laparotomy, you do want to have at least, and like C-sections, when you're making large incisions, you want to have a couple wet laps, because what they're going to do is they're going to use those when they put the retractors in. They'll put those wet sponges to keep everything moist.
Also for the neurosurgical, the cottonoids, it says moisten them with
Yeah.
saline, and we don't damage
Yeah.
section.
Yeah, you don't want them sticking to the brain. Yeah. And they make different types of sponges. They make like a telfa coated, and then they just have regular sponges. They talked about some other ones. Let's see. So the ones for neural procedures are called cottonoids. Okay. Kittner. So Kittners and peanuts to me are the same thing, but that's what this is. Okay. And they come in a pack of 5. So there's a question on the test, and I feel like I need to go in and kind of edit it a little bit, because it's asking what comes in packs of 5. So labs come in pack of 5s, and there's a few other things that do too, but that's what they're talking about. Kittners or peanuts. Okay.
Okay, so would it be labs?
No, it would be this. So I'm going to either have to reword that or take out labs. Okay, because labs come in 5s. So anyway, you put this on the end of a Kelly. Okay, you put your Kelly on there to hold it. Because of course you're not going to pass this sponge,
Right.
right?
That's how you pass it, and then you open it in their hands, or you give it to
No.
them in the can.
In the Kelly, and they use the Kelly.
And what are those?
These, you can think of them as Kittners or peanuts.
Kittners or peanuts?
Did you see those, Jennifer?
Oh, yeah.
Okay.
Okay.
A minute ago, you
You
said
put
they
it
use
in the
a
Kelly.
damp sponge for the retractor, like underneath the retractor blade,
Right, so like
On-
when you
on the
have a
patient.
retractor,
and then the retractor.
right, so you put a sponge in between the retractor and the patient, so it doesn't hurt the patient.
You suck it in your nose.
Yeah. Hey, they would come in handy, huh? I don't know that these are on there, but I'll just show them to you anyway. I probably should go grab a human stat. Let me go grab one so you guys can see how they work.
Well, it says kittens are small rolled cotton tape, and peanut sponges are small gauze sponges. No, rolls of cotton tape, small gauze sponges.
Maybe they're kind of used for like the same.
Yeah, pretty much the same thing. Blunt dissection of tissues, but it says peanut says also fluid function. I think Dale showed us these ones.
Yeah.
So is this a human stat?
No.
No.
What is it?
Mosquito.
That's a mosquito, isn't it?
It is.
Did you see these?
So these are called suture boots. Whoop, suture boots. Oh, I'm trying to get one. And they come in packs of 10. So you'd have to count these two, okay? 2, 4, 6, 8, 10. See?
Those are suture
Suture boots.
boots.
So they go on the end of a mosquito So that you might put it on the end of a mosquito or maybe a hemostat, okay? So,
Just kind of like a buffer?
so it actually holds suture. So if they want to hold some suture,
Not the
Kind
needle, the actual suture.
yeah, the actual
Okay,
suture
so-
itself. So, and
keeps
it won't
from-
damage the
yeah.
suture.
Okay.
And these usually have a sticky back on them, just like the peanuts do. They usually have a sticky back so you can stick them on your mayo stand or on your table or
Oh,
something.
yeah.
Okay.
So will not be on the desk.
Those, I don't think so. No, I
Suture.
brought them, so I thought I'd show them to you
Old
guys.
suture itself.
Every time I saw a mosquito on my tag, I didn't know if they're talking about that mosquito or like the little fly mosquito. It confused me a lot of the time.
They should always be talking about that mosquito.
Well, like it asks which one is a vector or which one is a fulmine.
Fulmine.
Oh,
Yeah.
yeah,
so it's
that
like,
would
well, I
be
don't
the
know which
exception.
one we're talking about.
So, like the flying mosquito would be a vector.
Yeah.
yeah.
Oh, that's a trick question.
Yeah, so microbiology, they'll be talking about those kind that buzz around.
Okay.
Yeah.
Well,
But
because then like
instruments.
one of the other ones, like Mayo stands on it and everything else too. I think that was for the foam light thing.
Really?
Yeah.
Oh.
So, I didn't know which one.
Like maybe objects that things can grow on?
Yeah,
Yeah.
so that would like Mayo stand was that answer, but then like I think mosquito was on it too, and then like surgical tech and something else. It's like I don't know.
Hmm. Yeah. Weird.
Okay.
They're testing you.
Mhm.
All right, it's you guys' call. We can either go through the dressing or just stop and call it good for today and then finish up the rest of this chapter on Monday. What do you guys want to do? Some of you have that glazed over look.
It was the pizza, probably.
Probably
Yeah.
was
Just pizza.
Y'all need a nap now. And I ran out of coffee.
Yeah.
Ah, you're out of coffee, yeah. Yeah, we'll just finish it
Finish it up on Monday.
on Monday. That way I can bring the dressing in here and
Oh,
show
that'd
you
be
guys.
cool.
Because we got tons of dressing, so. We'll do that.
So do you want to
What's
test
the
me
rate
on
text
this?
the
Is
one
it
that's coming
Tuesday
in
or
on
Wednesday?
Maybe Tuesday.
Yes. Well, that's why I was like,
I still haven't figured out what your assignment is for tomorrow yet.
You haven't? Oh, I was gonna
No.
look it up tonight. I was gonna.
Yeah, I'm like, maybe something on dressing.
Didn't get anything in your sleep last night?
sponges.
No, I didn't.
Latex come at 10.
Okay.
No, I can't even remember what
Laptop
I read.
lives.
I don't know which one.
Kid, yeah, the other one's coming from.
I'm probably just gonna list them all down.
This one just coming now.
So when do you guys need to turn in the corrections?
Monday.
So corrections
Okay.
for
And
ASC.
we can type them, we
Class
can
or on
write it, we can.
Either way. Either way. So if you want to do them and just email them to me, that's fine. Yeah. If you write them out, just make sure I can read it.
Anyways,
Okay, all right.
Yeah.
Yeah, I think it was just my boyfriend has nicer handwriting than me. I mean, it's not that bad. Like,
really nice.
Nice.
Do you need this one?
There's the cigarette brand.
Yeah. Some of them, just the time to learn how to write really well.
I just saw it. Just kidding.
I know you did. Just
And his sister saw how his mom was, so he's just like
Number 16.
16.
hours, like.
Yeah.
I have it.
So I'll think of an assignment for you guys today before I leave. And that will be your lab assignment for tomorrow. All right, and I'll give you up until 5 to get that turned in. But I'll figure it out here pretty quick.
Tomorrow?
Okay.
5 o'clock tomorrow.
Yeah, tomorrow. All right, any questions? Got anything? Nope. Okay.
So for the question number 18, sponges, maybe I think we think sponges.
So they usually come in, and to me that question's like, ah. So a lot of times sponges come in packs of 10.
Okay.
Okay, so like Raytech, Cottonoids, those come in packs of 10.
Okay.
Cottonoids come in a pack of 10.
Yeah. And
So it's 5 except for,
10
10 except for
dissectors,
peanuts.
peanuts. Yeah, but I mean, it isn't really just peanuts, so, because laps also come in 5s.
So dissection.
Tonsil and laps.
Okay.
Okay. And they come in packs of 5.
So is it just laps, we're not worried about the kidney or the tonsils? Or tonsil?
Right, yeah, those aren't options.
Those
So
aren't
I'm,
options?
no,
Okay.
but laps is, and I'm gonna take that off, or I'm gonna change the wording of the question or something. Okay, because to me, it's like, wait a minute, laps come in 5s. So,
I'll just list them on, just in case, maybe, hopefully.
yeah.
Hey, thank you for the pizza.
Yes,
Yes, thank you.
And our little bags.
You're welcome.
And the, yes.
You guys have a good day, and we will see you on Monday. Monday. So enjoy your extra day off. Do something productive, like study for your next AST exam. It's going to be, again, section 1 through 159. So whatever you didn't take this time, you'll probably get next time.
Section one again.
129.
Yeah, it'll be that section again.
40 questions or the whole thing?
No, probably 40 questions.
Okay. When? That was the whole thing, I was like,
Um,
okay.
Yeah, so the same section, just
different.
different questions.
Yes.
Yeah.
On what day?
Yes.
Probably 2. 2. Yeah, that day. Tuesday.
Of next week.
Yeah.
Tuesday next week, okay.
Whenever we take our test again.
Okay.
Maxine,
Yeah.
know.
do you have anything else that you're doing right now aside from, of course, exiting class?
No.
If you're able to look at the questions that I sent you through inbox, if
Okay.
I can call you or if we can Zoom again when you have the time, I just need to make sure to drop off one bill of mine before they close.
All right.
But other than that, I'll be available so we can discuss those questions.
Okay. All right. Well, let me just go check them. Give me about 30 minutes because it takes a while for this video to download.
All right, no problem.
Okay.
Okay, thank you. I'll talk to you later.
Okay. Bye.
Bye.